All right. Good morning. I'm Linda Sechrist, one of the co-founders of Grokking Wholeness. That's our website. And I am here today to talk to Dr. Mary Lambert, who is an acupuncturist and has been for a long time. So I'm going to let her introduce herself. Go
Hi, my
ahead, Mary.
name is Mary Lambert. I'm a board certified acupuncture physician, and I joke that I am a professional student. So not only am I a board certified and licensed acupuncturist, I'm a licensed massage therapist and licensed esthetician. I am a Reiki master. I've been certified at the master level in three different lineages. And so I've spent almost all of my career studying, the body, how energy works in the body. And I do need to add, I actually started studying energy by studying crystal healing. And so back in my 20s, I started a gemstone importing business where every stone that we received, I sat with and intuitively received whatever energetic messages were from that crystal or stone. And the fun thing is that when I was doing my undergrad, I was actually trying to get into research. I was trying to get into scientific research. And so getting into the gemstones was so amazing because the molecules, like, the chemical structures tickled that science part of my brain, but the energetic aspects of it brought things together in a completely different way. So now that I'm in private practice, practicing my acupuncture and all of my different modalities of healing, it brings everything full circle: the science, the energy, the fact that we are energetic beings. It's all kind of just come together into this perfect just synthesis of the different ways that we can work with the body.
Isn't that wonderful when you have that these different areas, but all of a sudden they congeal, they come together, and it just makes for a an expanded consciousness. So let's call it that. And I'm glad you said that we're energy beings. I want to tell the story quickly about my first trip to an acupuncturist was in Boston, where I think it might have been my yoga teacher who told me about him. So I went, and when he needled between my big toe and my second toe, I felt there was seriously a line of spark that went right up to my shoulder blade.
Mm-hmm. Mm-hmm.
and 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 I jumped, and he said, "Did I hurt you?" And I said, "No, but what was that?" He
That was electricity.
he said, "You must have had a blockage in there for that." And I've never had a response quite like that since. I'm glad I have everything open. So let's talk about acupuncture and the energy, particularly the energy of directing, trying to direct it in the body. But starting with someone comes in with symptoms, how do you determine which points to needle?
So to answer your question, I have to go a little bit into the background of Chinese medicine.
Okay.
And so, we historians kind of differ a little bit on how old acupuncture really is.
Mhm.
There are some records that are saying it's 3,000 years old. Some records, in the archaeological record, go back 5,000 years. There are formulas that we're using that are 600 to 1,000 years old. So we're talking about an ancient traditional medicine. This has been around for millennia. And so when the Chinese were, first developing these treatment modalities, they didn't have the fancy diagnostics that we have now. They don't have the imaging, or they didn't have the imaging. They didn't have the lab work. And so when they were developing their diagnostic methods, they had to focus on what was observable. And so they observed the body, they observed the symptoms, And they set up a whole diagnostic system of how to observe the body to understand where the imbalances are.
Okay.
And so we use a combination of methods. So first is inquiry. We talk with our patient, we gather information about what their symptoms are, what they're experiencing. And so, and I tell my patients this all the time when we're doing an intake, I'm going to ask questions that seem like they're completely unrelated to what your concern is. But what I'm doing is I'm gathering puzzle pieces to put together a pattern, because
Mhm.
that pattern lets us know what organ systems may be in disorder, in dysfunction. And so once we figure out what that pattern is, we confirm it by looking at their tongue and taking their pulses. So when we take pulses in Chinese medicine, we take them on both wrists. So that's one of the big differences in Western medicine. We take them on both wrists, and we're looking at three different sites with each pulse, like each side of the pulse. So we're getting information from the pulses on 12 different organ systems, as well as the state of qi and blood and dampness in those organ systems. So that's a lot of information that we're getting out of the body by just touching 6 places. The second observational method is we look at the tongue. And so, tongue diagnosis in Chinese medicine is so critical. We get so much information. Similar to the pulse, we get information about 12 different organ systems, the state of the digestion. We get a lot of information about the mental health as well of the patient. And so the way that we look at those two methods of observation, the pulse changes second to second. So that's giving us a snapshot of what that person is experiencing in that second. The tongue is a longer term kind of visual of what the person is experiencing. So the tongue, like the condition of the tongue, doesn't change as quickly as the pulse does. So that gives us like a better idea of what that person has been experiencing long term. So if there are chronic conditions that are in place, et cetera, that's how we gauge that information. And then there are other observable things, like the person's complexion, their constitution. One of the interesting little tidbits is that the thickness of somebody's eyebrows gives us a an insight into how well that person can withstand chronic illness. So there's a lot of observable diagnostic tools that we have in Chinese medicine. In my personal opinion, I believe that one of the reasons that Chinese medicine hasn't become more mainstream in America is because of those traditional diagnostic methods, because we use very poetic language. We talk about things like liver yang rising or internal wind, and dampness overflowing, water overflowing. And so these terms are diagnostic in Chinese medicine. But if you say those words to a Western medicine practitioner, they're going to look at you like, no, you're talking some hooey here. You're talking some hooey. And so one of the things that acupuncturists in this day and age do, we have to combine that millennia old wisdom with today's modern language, today's modern interventions. And getting to that point where, with my patients, I'm like, do I need the labs? Do I need your diagnostics? Do I need your imaging? No, I don't. Does it help me fine tune what you're going through or what my treatment plans are going to be? It can, yeah, absolutely. But do I need them to get started? No, no, I don't. And so that becomes, such a crucial interaction between, patient and practitioner, where we have to listen, we have to hear and observe, which is such like I said, it's a crucial part of this medicine. And we don't get that anymore in Western medicine.
So I really, when you say all that, that learning to observe, most people have problems listening,
Yes.
as I'm sure you know from your job. So the observations, those are things that they must teach you in school, and that was the one thing I was going to ask about because in Florida, doctors of acupuncture are considered primary care physicians, which means you can treat a patient who is ill. And I don't think that most people understand that you're a primary care physician. And I've spent time with you, so I know how much intake you have initially into the patient. But how many years do you have to go to school to be an acupuncturist? And then I understand that you're going on for your doctorate in acupuncture. So you are an eternal student.
I joke all the time that I am a collector of fancy wallpaper. So the education required to be an acupuncturist, and it does vary state by state. There is a movement in the WHO, the World Health Organization, and the national certifying body for American acupuncturists, where the doctorate is now the entry level degree. Previously, it was a medical master's that was the entry level degree into practicing Chinese medicine. And so ideally in a perfect world, you would have, an associate's or a bachelor's degree before you go to an acupuncture school where you get a medical master's degree. And that's a 3,000 hour degree. And that is on top of, whatever other education you already have. Like I said, bachelor's or associate's minimum. And so that's a 3,000 hour degree with 1,000 hours of patient care. And so that gives us the ability to sit for boards. And this again varies state by state because there are some states that you don't have to sit for boards. There are
Mhm.
some states that, like Florida, for example, we have to sit for 4 boards. We have to sit for the Chinese Medicine Board, Foundations of Chinese Medicine. We have to sit for a Western Medicine Board, a biomedicine board, essentially. And then we have a board for herbal medicine and acupuncture that we have to pass. So I was joking with my primary, who is a DO, and is his focus is internal medicine, family care, and so we were joking that for him to become a DO, he only had to pass 2 boards, and I was like, how is that fair? 4, really? But because we're practicing Chinese medicine in a Western society, we have to be versed in both languages. And so that's where the biomedicine board comes in. We have to understand what typical interventions are in Western medicine, what pathophysiology looks like in Western medicine. And then we additionally have to have that same pathophysiology in Chinese medicine. And then if we're practicing herbs, herbs or injection therapy, we have to understand not only how the herbs work, but we also have to understand pharmacology and what kind of herb drug interactions we may be dealing with.
Okay.
So it's complicated, but it's all complicated in terms of maintaining patient safety.
Hmm. So you studied then for whatever drugs they're on, you know which herbs you can and cannot recommend. And
Correct.
so can you write prescriptions though or do you have to have under a doctor's supervision to do that?
I cannot write Western pharmaceutical prescriptions. So if someone comes in and they need a refill on their blood pressure medication, that's not something that was within my scope of license. I can write prescriptions for herbal,
Yeah, remedy.
medications instead, which I do, and especially with the injection therapy, which is something that is unique to very few states in the U.S. I think and I could be wrong. I'm sure someone will correct me. I think it's 5 states. It might get 5 states that acupuncturists can perform injection therapy.
Okay.
And so the fun thing about that is that we're combining a modern intervention with ancient wisdom. That's so fun. It's so fun.
I know I've had injection therapy. The last time I was there, I came to you when I was healing from some surgery that I had. And it really does help to make sure that energy is flowing through those meridians so that my body could heal. So do you want to, and talking about that, when you're talking about the observations that you make of someone, do they teach you in school what to look for specifically to observe people?
We call it the four pillars of observation. It is inquiry, auscultation, so we're listening. We palpate, so we touch, we feel. Especially if there's pain involved, we're gonna touch. And then we're going to ask questions. We're going to observe. And so we're going to listen, not only to what the patient is saying, but listen to their body too. So there are times where, I have my stethoscope out and I'm listening to someone's digestive sounds. I'm listening to someone's lungs. I'm listening to, the way that their heart is beating. And so, and this is on top of, talking with them. The way a patient smells gives us a lot of indicators as well.
Oh,
So if someone comes in with a very, very, fruity, sweet smelling breath, that gives us a lot of clues as to what's happening. So we go through and we learn those four pillars of observation, and we get tested on it too. We have to perform practical exams where we're performing this in front of another doctor, and we have to be open to correction. But I want to touch on something really briefly, and I think we're going to wind up coming back to this, where you were talking about the meridians.
yes, yes.
So the meridians are one of the amazing things about practicing traditional Chinese medicine. The meridians are the energy pathways in the body where the acupuncture points are located, but these pathways, think of it like your nervous system or your vascular system, where we're transporting things through the body. And so we're using those pathways to clear obstruction, to send messages to the brain of, this is what I need you to do, this is where I need you to focus. And so one of the books that we read, and I highly recommend this for anyone who's interested in Chinese medicine, is a book written by Ted Kapchuk, and it's called The Web That Has No Weaver.
A web that has no weaver. Okay.
And so he goes into the dynamics of the channels and the meridians in the body. Because what do you mean? I can put a needle at your big toe on your foot and you feel it zap into your shoulder. How is that possible?
Yeah.
And so he really goes into detail about how the meridians work and what we call low connecting meridians, low connecting channels. And so if we were to put all of these meridians and connections together, it would turn the body into a web. And so we use that web almost like, like we used to joke, the World Wide Web, that kind of thing. Where there's
Yes.
connections here, there, and everywhere. It's similar in the body as well. And one of the fun projects that I had to do recently was talking about what the physical structure of those channels are. And it's absolutely fascinating because if you look at the meridians, they follow similar pathways as the major blood and nerve supply in the body. So that tells us immediately we're working with the nerves, we're working with that electricity, and we're working with the blood. And those two substances, qi and blood, are the main things that we work on bringing into balance with acupuncture. And so when we put that needle, at your big toe in your foot,
Yes.
that wakes up that whole channel, that wakes up that whole meridian. and wakes up different parts of the body where those connections wind up going to. So we wind up activating that whole web throughout the body. And then we use, the information that we used, that we got during the intake, during our diagnostics, where we were taking pulse and taking, tongue diagnosis. We take that information, come up with a pattern where we talk about the organ systems, and then choose points to start bringing into balance what it is that is out of balance for that patient.
Do those meridians or that web have anything to do with the myofascial system?
That's the current theory. Yeah, I wrote a
Ah,
paper for it this past semester for my doctorate, where it is, the prevailing theory right now is that the fascia is what makes up the meridian system. And so the fascia it has pain receptors in it. We call those nociceptors. And depending on the state of the fascia, if those nociceptors get stimulated in just a certain way, they create what's called neurogenic inflammation, meaning that that fascia becomes inflamed, and so it stiffens. And when we have inflammation, nothing's coming in or out. There's no nerve pulses coming in, there's no blood coming in, and there's nothing going out either. So when we needle a point that activates that nociceptor in that fascia, it winds up reducing the neurogenic inflammation, which takes down pain reception, that kind of thing, sort of down regulates the nervous system. And then guess what? That inflammation goes away. And so now we can get nerve signals in and out, we can get blood in and out. And so that follows one of the basic Chinese medicine tenets of, when flow is obstructed, pain increases. And so there's the physiological
mm,
reason of, hey, that fascia got inflamed. There's nothing coming in and out. And now your pain levels are going up. And
mm.
so we use pain as an easy example. One of the other fun little tidbits, did you know that endorphins were discovered because they were trying to figure out how acupuncture works?
No, really.
Isn't that fun?
That is endorphins, which are things that make you feel great. So, yeah,
Mhm.
through acupuncture. Well, thank God for acupuncture then.
Exactly.
Well, let's talk about chi, which is energy, because I do believe that we are energy beings, and
Mhm.
that energy is in our bodies, but it's universal. So let's talk about how it gets in and how to keep it flowing.
So when we talk about qi in Chinese medicine, there's actually a lot of different forms of qi. And qi, energy, the terms are pretty interchangeable. And so, when we talk about qi, we actually have to go back to that moment of conception, where we form the matrices of the meridians. So, at that moment of conception, when we're talking about sperm and fertilizing the egg, etc., what happens is that that moment captures the state of the health of both parents at that moment of conception.
Mm.
And so it's not only their emotional health, but it's their physical health as well. So if your parents had a lot of babies before they had you, their chi's not as strong. Their chi has gone into multiple other children. And so
Uh-huh.
you're kind of sharing that load a little bit with your siblings. And or if you're an only child, and so that changes how your chi gets built. If your parents have any kind of illness, whether it's physical or emotional at that moment of conception, that influences that matrix that you grow into. And so we call that pre-heaven essence. So that's the first form of chi that we have.
We have an essence.
And so that pre-heaven essence goes into determining what our constitution is. And
Ah,
if you want to think about it in Western terms, that's also our genetic material.
DNA.
Exactly. Exactly. And so, like I said, anything that's happening emotionally to your parents, and for, for our relationships with our mothers, the entire time that we're in our mother's tummy, everything that she's experiencing, that baby is experiencing. And that is getting written into that baby's pre-heaven essence as well. And so all of these things, come into play. And so the pre-heaven essence is stored in our kidneys. That becomes the basis of the matrix that we grow into. So we have our organ meridians that we talk about. We've got our kidney meridians, our liver meridians, et cetera, et cetera. But we also have what are called extraordinary vessels. And those extraordinary vessels are how our pre-heaven essence gets moved throughout our body. And so these vessels, the two that get talked about the most are the conception vessel and the governing vessel. So we're
Mhm.
talking about the renmai and the dumai. And so the conception vessel runs up the center line in the front of the body. And so that conception vessel, goes through, it starts in the reproductive area. It starts on the perineum and runs up the front of the body where it crosses the reproductive organs, crosses through the digestive organs, crosses through the heart, crosses through the lungs, comes up, through our throat, and then comes up into our mouth.
Mm.
And so the governing channel correspondingly goes, well, let me be correct here. It also starts on the perineum, but it runs up the back of the body, runs up the spine, comes up the spine and down the front of the skull, and they kind of meet right around the mouth area. So those are probably the two most famous extraordinary vessels. And we've got other extraordinary vessels. We've got the Yang Mai, or the Yang Wei, the Yang Chao, the Yin Wei, Yin Chao, et cetera, et cetera. And they all do different things, but those vessels are how the pre-heaven essence gets transported throughout our body. And so pre-heaven essence, so the baby is born, the baby is grown up, baby is, let's say, they're in their late teens. And so at that point, our pre-heaven essence kind of becomes our battery for our chi.
Mm.
And so that becomes our long-term storehouse of what our constitution is. Do we have asthma? We look at, childhood asthma where, the child was born with it, they were born with weak lungs, etc. We look at that as a pre-heaven essence deficiency.
Ah,
And so there are a lot of things that we wind up, the genetic conditions we look at as a pre-heaven essence deficiency. And so, little things like that, where like the teeth don't come in properly, or they come in small, or they come in misshapen. Those are pre-heaven essence
mm,
deficiencies. And so as we live our life, our hope is to not tap that battery of that essence. And so now this is where the second type of chi comes in. This is our post heaven essence. And so our post heaven essence is comprised of how we live our life, the quality of the air that we breathe, the quality of the food that we eat, and the quality of our lifestyle. Do we work too much? Do we sleep too much? Are we too lazy? Are we working out enough? Are we exercising enough? Are we exercising too little? Are we exercising too much? All of these things determine, if we use up all of that post heaven essence, we're going to go back and we're going to tap that pre heaven essence.
ooh,
We're going to tap that battery. And so cultivating that post heaven essence in Chinese culture, you hear a lot about cultivating qi.
yes, yes.
And so this is why it's important. So you cultivate qi through meditation, through mindful movement, through living a grounded, centered life where you're taking care of your body, you're taking care of your mental health, you're taking care of your environment. If you're living in an area where there's a lot of air pollution, the quality of the air that you breathe directly impacts your chi.
Mm,
And so when we live a life where, we have, that solid cultivation of post heaven essence, then we don't tap that battery, so to speak. But in situations where we do have to, tap that battery, essentially, we look at, conditions of, chronic illness, or, heaven forbid, someone who has cancer. At that point, their post heaven essence, they can't get enough of it. They can't cultivate enough of it. And
mm.
especially where illnesses are, really debilitating the digestion, really debilitating the ability to move, you cannot cultivate that post heaven chi. And so you wind up draining your pre heaven chi. So chi cultivation becomes a big part of when we talk about the health of the body, because our goal is to cultivate our post heaven essence so that we don't tap that battery that our kidneys house.
I remember one time an acupuncturist telling me never to, and he didn't explain why, but he was, because I was exhausted. I was absolutely exhausted. And he said, you never tap that energy. There's like a storehouse, but he didn't explain the two. Tap that energy because that's energy you need. So, but I'd never heard that before. And now you explain what he was talking about.
Yep, yep. And so the Chinese word for pre-heaven essence is called Jing. And
Okay.
so
Jing?
Jing, yeah, Jing.
Okay.
And so it's not impossible to cultivate that pre-heaven essence, but it is very, very difficult. It's very, very difficult to cultivate that pre-heaven essence because again, that's a snapshot of that moment of conception. And so it's much easier to cultivate that post-heaven essence, and that winds up going into all sorts of different kinds of chi. So when we talk about the chi for the lungs, that's qing chi. If we're talking about the chi of digestion, that's gu chi.
Mm.
We talk about yuan chi, which is source chi, and then zheng chi, which is upright chi. We talk about wei chi, which is our immune system. And so, there are so many different forms of chi that we use we use from that post heaven chi to create the different kind of subsets of chi that go more specifically into like the different organ systems and the different body functions.
So chi isn't just chi. No, and all this time I've been just thinking chi. I didn't think about it in all those different aspects. But does it all come from one source? The chi comes from one, there is a source, right?
There is a source, yes.
Thank you.
So, particularly in Reiki, we look at chi as being, universal.
Yes.
Everything that exists has chi.
Chi, yes.
And so, with intention, we can move that chi. And we can either move it where the chi is one of the other forms of chi that we talk about in Chinese medicine is xie qi, which is evil chi.
Oh,
And so this is when, there is dysfunction in the body. This is when, there is disease present. And so we look at that disease process as evil chi. And
oh.
so when we look at that evil chi, we need to remove that evil chi. And so there is a lot of overlap when we talk about Reiki, when as well as when we talk about medical qigong in Chinese medicine.
Yes.
And so that is the action of specifically and intentionally moving chi.
Oh, okay. Do you practice Qigong?
I do.
Okay.
And so qigong, so there's two different ways of looking at qigong. Qigong is a meditative practice where
Right.
we are intentionally cultivating the qi of our organs.
Okay.
And it's similar to Tai Chi, but Tai Chi tends to be a bit more martial arts oriented, where Qigong is less less martial arts oriented and more about chi cultivation. It's gentle movements, but we're cultivating the chi and we're grounding our chi as well.
Mm,
And so medical qigong builds on what we develop in qigong.
okay.
So qigong is the cultivation, medical qigong is the application.
Okay.
And so very similar to Reiki, we are using our hands to move energy.
Mm,
And so we can remove that evil chi with qigong, with medical qigong, I'm sorry. We can remove that evil chi and then refill it with good chi.
ah, okay.
And so very similar in practice as with Reiki. Sorry, I just had a hiccup there.
Okay. I had one too. So, um, with that, talking about chi, I lost my train of thought here. I was so interested in what you were saying about removing and cultivating and evil chi. I'd never heard that terminology before. Um, so in practice, I know that I've seen some qigong movements and people who teach it. Actually feeling and looking at the energy that their hands are moving in. So do you teach, I mean, do you talk to your patients about taking up that to cultivate their chi?
I do. I do. I've got specific websites that I refer my patients to and recommend. There are a lot of really great YouTube videos on Qigong. There are a lot of amazing creators who have shared their knowledge and their expertise because it's not a difficult practice to get into,
Okay.
but it is something that does require some mindfulness. And some of my favorite creators combine yoga and qigong.
Ah, that would be a wonderful combination because I know how good yoga is. So
Mhm.
for the body. Well, I want to say that this has been a very interesting conversation, and I hope that we have another one and can talk more because this is a huge subject to talk
There's a
about.
lot that we can talk about in terms of energy and chi. Oh, yeah.
I just want people to understand, our Western medicine is so pharmaceutically oriented. And then if you have a symptom, you take some kind of a pill. And, I've been writing about the alternatives for so long, and there's so much value in them that I consider if we use them, it's what I call self care.
Hmm.
And I believe that self care is the new health care.
Hmm.
We don't necessarily need, we need those Western medical systems when we have truly, if we get into an accident, if we fall, if we break bones, if we need replacements, etc.,
Hmm.
then we really need it. But there's so much that we can do for ourselves by using an acupuncturist. When I was in between work, for 2 years, I used a chiropractor, an acupuncturist, and yoga. And that's what I used to take care of myself until I could get to Medicare.
Hmm.
And I learned you can do that. You have to do the whole picture, not just one little piece of it, but do the whole thing. And so I'd like to have another going on to you're doing more studying. So I will rely on your schedule to let me know when you're ready to do that.
Well, one of the fun things, I'm kind of piggybacking off of what you just said. So when I was finishing up one of my end of semester projects, we wound up having a class debate, and we were talking about evidence-based medicine and the evidence that the studies and everything that Western medicine relies on.
Oh, okay.
And one of the challenges in terms of acupuncture and Chinese medicine is that because it's such an individualized practice, so we customize every treatment to the patient and what they're going through, which is kind of antithetical to what Western medicine does. It's one pill to one disease, that kind of thing.
Yeah.
And so it makes researching acupuncture a little challenging. And so we had a class debate on if randomized controlled trials are the gold standard for studying acupuncture. It's the gold standard for all Western medicine, research. But is it really the gold standard for acupuncture and Chinese medicine? And one of the big things that, the big takeaways from that debate is that it doesn't measure the preventative medicine that acupuncture provides.
Ah, okay. And that's what I used it for 2 years.
Uh-huh.
I went once a month.
And preventative medicine, there are only two real modalities that offer truly preventative medicine: traditional Chinese medicine and acupuncture, and chiropractic care. Those are the only two really truly preventative medicine modalities that are available. Everything else in Western medicine is very reactionary. We have to wait until disease is presenting in Western medicine. But in Chinese medicine, no, we can work to either slow progression or stop progression.
Okay. Maybe that's where we start the next time.
Yep, sounds perfect.
Okay. Well, thank you so much, Mary, for.
My pleasure, Linda. It was great to talk to you.
All right. Thank you.
Bye bye.
Bye. Oh, I just want to say, Grokking Wholeness, be sure to check out our website and subscribe to it. That's GROKING Wholeness, WHOLENESS.com. And there are plenty of videos on there of different subjects, but we're all about raising consciousness. So join us